Hello everybody, my name is Ebon Turner and I was assigned to present on behavioral health this semester in medical terminology. This presentation will take y'all through a simple introduction to behavioral health, then focusing on the central and peripheral nervous system. I hope all y'all and Professor Craig enjoy it. Welcome everyone to behavioral health. The American Medical Association refers behavioral health to mental health and substance use disorders, life stressors and crisis, and stress-related physical symptoms. Behavioral health care was created to help each unique individual with their own specific mental health needs. These care centers handle the prevention, diagnosis, and treatment of those conditions. You may be asking, what specifically is behavioral health? Well, the Centers for Medicare and Medicaid Services define behavioral health as emotions and behaviors that affect your overall well-being. Think homeostasis and everyone doing their best to remain at equilibrium. So now we know the importance of promoting each and every person's overall well-being. That includes both preventing and treating each unique individual's mental illnesses and/or substance use disorders. Behavioral health is most definitely greatly decided by everything listed below. Take a second to look for yourself below while I describe them to you. Things like cognitive behavioral therapy would be associated with mental health cases where individuals are facing more psychological or emotional problems. Each unique individual will have their own social well-being in which they will live their lives within those bounds of every day. In medical terminology, we would associate detoxification with substance use disorders. Drugs like alcohol, cocaine, methamphetamine, and heroin are drugs widely used around the world today. Circadian rhythm can be quickly identified as relating to an individual's heart. Individuals' behavioral patterns will most likely predict their health. Lack of exercise, low amounts of water intake, poor sleeping habits, and malnourishment will likely lead to very poor health. So you may be asking, why is behavioral health so important? Well, ultimately, having a history of good behavioral health patterns boasts increased productivity, lower healthcare costs, strong mental well-being, better relationships with your family and friends, and increased positive impact on your community. I even went on to say this quote, everybody benefits from a society full of individuals with strong and ethically driven behavioral health. The central nervous system is the body's control center, and it includes both the spinal cord and a person's brain. The brain is literally every human's boss, and it decides what a human is going to do. The brain processes all information, makes every decision, and sends out every command that is made. As for the spinal cord, it is a human superhighway that carries all the messages from the brain to the rest of the body. As for how the peripheral nervous system works, it is the communication network that connects our brain to the rest of the body. It includes every nerve that isn't the brain or spinal cord, and every nerve it has can be seen as a messenger nerve that relays information to and from the central nervous system. The PNS contains two different parts known as the somatic nervous system and the autonomic nervous system. Somatic controls every voluntary movement, and the autonomic controls every involuntary activity. Now let's zone in on mental health, which the CDC Center for Disease Control and Prevention says our emotional, psychological, and social well-being most definitely affects how we think, feel, and act. Intrinsic and instrumental value is applied to mental health by our society. An individual's mental health problems can be greatly influenced by their unique economic, geopolitical, and environmental circumstances, along with their genetics, substance use history, and emotional handling skills. Today, 1 in 5 adults can be expected to experience some form of mental illness every year. Depression is the #1 cause of disability on Earth. This presentation will focus on major depressive disorder, and you are going to be shocked how prevalent it is in our society today. Anhedonia is a Greek word meaning the inability to feel pleasure, the an meaning without, and the hedon meaning pleasure. Substance abuse is more prevalent than ever, and as of 2020, there was found to be 19.3 million adults worldwide with a substance use disorder. Individuals who use substances are more likely to develop chronic diseases, have an overdose episode, or even die from their substance of choice. Drug addicts can expect to be spending a lot of money to get their fix. Heroin junkie and crackhead are famous names that come to mind when referencing drugs. Prescription drug abuser or alcoholic are also associated with negative behavioral health habits. Over time, a drug abuser will increase their tolerance, have withdrawals if they stop using the drug, or even have trouble detoxifying. If the drug use persists, the only last option is rehabilitation. Higher medical and legal costs are likely to result from drug use, and once a user is addicted, they can soon to become dependent on the drug. Once a user stops, it's only a matter of time before they begin craving the drug again in relapse. So we've been speaking about individuals' behavioral patterns. Today in the US at least, every individual is free to live their lives how they so choose as long as they are following the law. Individuals can choose not to work out, smoke, not drink water, or even not sleep. That can all be done, but their health will definitely pay for it in the future. Behavioral health takes into account each unique individual's daily habits. Once daily habits are assessed, things like BMI, an individual's glycemic index, insulin resistance, or metabolic syndrome can also be assessed to determine their role in poor health outcomes. I may have only listed a few, but there are many other factors you can lay the blame on for their roles in an individual's poor health. Major depressive disorder can be known simply as depression, which is a persistent feeling of sadness and loss of interest. Depression can literally have a profound impact on what an individual is feeling, thinking, or even control how they behave. Just to list a few of the many symptoms, somebody experiencing depression would likely feel sadness, anger, a loss of interest or pleasure, as we know is represented by anhedonia, reduced appetite, or even insomnia or troubled thinking. If somebody is feeling depressed, it's very important that they reach out to their doctor or nearest mental health professional before it's too late. According to the World Health Organization, there are 280 million people worldwide that have depression today, accounting for 3.8% of our global population. Women are known to be 50% more likely than men to experience depression, and 10% of pregnant women or women who recently gave birth experience depression. Depression can lead to things like suicide, lack of appetite, or anhedonia. And suicide is the fourth leading cause of deaths in individuals aged 15 through 29. There are many different causes of major depressive disorder, but usually the chance of MDD is determined by psychological, environmental, and neurological factors, or even an individual's genetic predisposition. An individual's history of trauma, personal traits, imbalances of chemicals like serotonin or dopamine in the brain's neurotransmitter, or even a history of depression in the family can increase an individual's likelihood of developing depression-like symptoms. In America, over 21 million adults are experiencing major depression. 3.7 million youth ages 12 to 17 are experiencing major depression too. Many of these individuals never seek the medical help they need, and they don't believe their major depressive disorder is a serious condition. Due to this statement alone, many of these individuals never fully recover back to their happy selves on their own. As I said earlier, MDD is more common in women than men. Those living in middle adulthood are more vulnerable, but MDD can occur at any age in a person's life, whether they be in their early childhood or considered elderly. Neurotransmitters deal with chemicals like serotonin, dopamine, and norepinephrine, which all regulate how the individual will come to feel. Individuals with major depressive disorder often have lower levels of serotonin than an average person. This causes disrupted sleep, appetite, and depression-like moods. As for dopamine levels, individuals with MDD can be expected to have lower levels of dopamine, With lower amounts of dopamine circulating through a person's brain, you can only expect them to experience anhedonia. Lastly, norepinephrine can also be expected to be lower in an individual with MDD, causing them a harder time to concentrate, more fatigue, and less ability to cope with stress. It's important that we understand brain structures that are associated with major depressive disorder, and these brain structures are known as the amygdala, prefrontal cortex, and the hippocampus. The amygdala is responsible with handling all emotions, unlike chemicals in the neurotransmitter of an individual with MDD. The amygdala is overreactive in these distressed individuals. The prefrontal cortex, which is responsible for deciding an individual's decision-making and social behavior, is less reactive than seen in an average person. Lastly, the hippocampus is known for regulating mood and memory, is shrunken in individuals with MDD due to increased exposure to cortisol, which shrinks it. Increased shrinkage leads to mood disorders and impaired memory. Take this term in with a grain of salt. The hypothalamic pituitary adrenal axis is responsible for controlling how the body responds to stress. Dysregulation occurs in individuals with major depressive disorder, which entails higher levels of cortisol and more damage to brain cells in the hippocampus. Being in this state for prolonged periods of time only leads to more fatigue, difficulty concentrating, and a more disrupted ability to handle stress. Signs and symptoms of MDD include fatigue, persistent sadness, anhedonia, hopelessness, negative changes in appetite, withdrawal from social activities, irritability, retardation, insomnia, hypersomnia, thoughts of death, or even suicide. Medical and psychotherapy treatments for major depressive disorder include things like the offering of antidepressant medications or even electroconvulsive therapy. Some different forms of antidepressant medication include serotonin norepinephrine reuptake inhibitors like duloxetine or tricyclic antidepressants like nortriptyline. Electroconvulsive therapy includes individuals with severe MDD, and it involves giving the individual controlled seizures under anesthesia. You may see things like antipsychotics and mood stabilizers used in different types of treatment therapy too. Things like mindfulness-based cognitive behavioral, dialectical, and interpersonal therapy can also be used to help individuals with MDD. The whole goal is helping individuals learn to cope with their own unique experiences through meditation or the use of stress management techniques. Simple changes like 30 minutes of added exercise, an hour of stress management techniques like meditation, and instilling a strong, healthy diet into an individual's daily life can be a total game changer for MDD patients. If the patient received the proper treatment, it could be expected that the patient will experience significant changes for the better of their overall well-being. There is always the risk of developing co-occurring disorders or relapsation, but continued therapy and continued love and support from your loved ones could prevent MDD or other disorders from redeveloping. Jane is experiencing serious symptoms of depression. Dr. Turner is extremely worried about Jane's health and well-being. Jane has a history of chronic heart disease, insomnia, and overweightness. Dr. Turner asks Jane how she's doing and immediately sees she's in intense distress. After many hours, it is decided that Jane wants to go through with electroconvulsive therapy. After 3 short months, Jane is back to normal. Dr. Turner fears a relapse, so he decides to schedule monthly checkups with Jane to ensure she stays happy and healthy for the rest of her life. Behavioral health is a very crucial aspect of ensuring each individual's overall well-being. Mental health, substance use disorders, and an individual's behavioral patterns have a huge effect on each individual's quality of life. There are different disorders that can be categorized into one of the 3 categories. In this presentation, I chose to focus on MDD, major depressive disorder, because I believe it is one of the most prevalent disorders experienced around the world today. Serotonin, norepinephrine, and dopamine greatly contribute to how an individual is feeling. Serotonin, norepinephrine, and dopamine greatly contribute to how an individual is feeling. Over-the-counter medication and different forms of therapy like cognitive behavioral therapy can help people recover from their depression. But it's important that continuous checkups happen after to ensure that person doesn't relapse back into sadness. Let's all work together as we head into the future to ensure and promote clear mental health awareness. Make sure you're checking in on your friends and giving them support when need be. Who doesn't want to live in a community that shows compassion and understanding for everyone a part of it? You never know when your family or friends may be contemplating suicide. So make sure you are checking up on these loved ones every day because you won't want to lose them sooner than later. Thanks again for tuning in, everyone. Until next time.